The reason I started Combat Blindness, I wanted to give back, and I realized that retina problem was not the major blindness problem. It was the cataract, cause of blindness for half of the world blindness. Furthermore, I realized that it costs so little to treat a cataract in a developing country.
37 million people are blind. If we do nothing, then in 20 years, we're going to have 70 million people who are blind. We have to do something.
The cataract program of CBI is really important. In underdeveloped countries, if someone has cataracts, they go blind if they don't have the surgery. And we now know that the surgery is simple, but also can be provided in a country like India at a very low cost. So it enables the person to not be a burden on their family, and more than that, to go out and resume earning a living, contributing to their family and to the community.
Combat Blindness International has played a major role in it. They were among the first organizations that came forward to support cataract surgery at Shroff.
We have a personal connection in that Suresh, through Combat Blindness International, helped AutoLab to get started. And their help came in at a very, very crucial time.
At Combat Blindness, we are very deliberate as we have made sure that our vision screenings happen at the time where it can have the greatest impact in a child's visual pathway. And so not only do we do the screening at the right time with the help of the school system, but we also provide the intervention at the right time.
What CBI does very well is the issue of prevention. So whether you consider the children's kind of screening programs at the schools and things like that, that's really trying to address that this doesn't become a problem for an entire generation or series of generations in the future.
We are almost screening 80 to 90,000 children every year in India, in Paraguay, and here in Wisconsin, in Dane County.
But more than just numbers, I think when I visited some of the schools where we're doing these screenings in Mysore, and I see that impact of a child who now can continue on in school and do well in school because they can actually see, that is transformative.
Training has become the backbone of eye care service delivery. We've been training allied health workers, young women from rural and not so well-off families who have become the paramedics taking care of refractions, vision centers, ophthalmic nursing assistants assisting in surgery, counseling, and medical records keeping.
To see these young women, they come in, they're very timid and shy. They're given an education, training, a stipend, and they are also given life skills.
When I think of the impact of the COPS program, it's such a ripple effect because they're getting this economic opportunity. They're increasing the hospital's capacity to treat patients, to do more surgeries, do more screenings. And then on top of that, they go back to their villages after they're trained. The patients they see in those villages are so much more comfortable with somebody from their own village. So it's such an increase in patient care, and so it just creates this wonderful circle effect.
The culture of CBI is one of the most important aspects of the organization. It's welcoming, it's inclusive, it's encouraging, it's supportive. It all goes back to how Dr. Chandra started the organization.
It is important that people be part of this because it's a global problem and we are global citizens. As a global citizen, it's our responsibility to be able to help our fellow citizens.
The people that we are providing sight to today, that becomes a generational gift. And that gift is fed down through their grandchildren, children, on, and it provides an amazing benefit to a world that without the opportunity that CBI is presenting, their whole existence becomes more dire than it probably is already. So,
what excites me about this is that in such a small amount of money and short period of time, you can change somebody's life. It is just amazing to see when you do a cataract surgery and next morning the patient can see.